Hello, and thanks for joining this workshop. We are here to discuss some trade secrets about optimizing your fellowship in your second year. We have two esteemed guests who are just such shining examples of how much you can accomplish in the field you're so passionate about. Dr. Meltem Zeytinoglu is an assistant professor of medicine at University of Chicago, where she is also a fellowship program director for adult endocrinology, diabetes, and metabolism. Dr. Zeytinoglu's clinical and research interests include endocrine education, diabetes, and osteoporosis, as well as diabetes in older adults. She has been involved with Focus on Fellows programs since it started as she started as an attendee for the first year and then as a part of ADA's early career advisory group in subsequent years. Dr. Rong Zhang completed her internal medicine residency at St. Louis University and endocrine fellowship from WashU in 2017 and has remained on the staff at WashU. She's currently active in translational research evaluating the role of inflammation in diabetes, in addition to both inpatient and outpatient clinical responsibilities. Welcome both. And to the audience, I'll say that this is an interactive session and is designed keeping an open format in mind. We welcome questions. We actually encourage them. Please bring those questions. So let's begin. This question is for both our speakers. How do you describe your professional roles and responsibilities and give us a rough estimate of your present involvement in each role? I'm asking this question to highlight your professional evolution since your fellowship.
I can go ahead and get started, and thank you, and I'm excited to follow up after Dr. Munoz in her passion. I think, the fact that you all have chosen to be endocrine fellows and diabetes specialists when the burden is so great in the population, and it's not always an easy profession. I really want to commend all of you. That's why I'm here, because I share your passion, and I want to help develop as many diabetes specialists as possible. And so that's really what drove me. I just in a very brief summary, I did my fellowship training where I am at the University of Chicago, and I had intended to do a 3-year fellowship with an interest in research, clinical trial research in particular. But when I was in my very beginning, I should say, of my 3rd year, a faculty position opened up, and I was invited to apply for that position and encouraged to do it. And it was a clinical position that perfectly mirrored my clinical interests. And so it was a difficult decision because I knew that once I got into a clinical position, I would still absolutely be able to do research, but that protected time would be much harder to gain once I started a busy clinical practice. But it was the right position at the right time. And so I accepted that position, and early on was very motivated. There was no associate program director position in my fellowship, but was eager to sort of start some new didactics and new things. And so I helped my mentor, who happened to be the fellowship program director. And then that gradually evolved into me becoming the program director as she was ready to step down. And so that's just a brief summary of how I got where I am.
Thank you. Dr. Zhang?
Yeah, so actually, I started my fellowship here at WashU in 2017. I graduated, I guess, technically in 2019 with my 2 years of clinical fellowship. I did go on to do a 3rd year as well. And so, this year was actually my first year on my own. And my time has mostly been spent 75% protected time to do research. And then 25%, I still maintain a half day of clinic and some inpatient duties. And I did some internal medicine. And it's been a wonderful year, and I've really appreciated that time. Most of my time right now is, trying to, work on my project and, submitting papers and, writing grants to try to prepare for a research career development award. But, everything the third year was something that I had planned, probably starting my second year. So, these are things that, are available to you if you are interested.
Thank you. So you see, we have examples of a clinician, educator, researcher, combination of everything. My next question is to Dr. Zeytinoglu. How did you get interested in clinical education, and what foundations did you lay for the same during your fellowship?
Thank you for the question. And I just realized I forgot to mention my percent split, which is right now, I have 20%, 5% protected time for being a program director. There are various administrative and teaching planning things that take some of my time. I spend 2 days in the clinic with a very complex patient population, a very sick patient group. And then I spend the other amount of time on some focus on older adults and research and some clinical trials there. Time management is a skill that I continue to work on. And I think that's really important to work on in the later part, especially of your fellowship. In the first year, you're just trying to kind of stay above water, getting your feet wet with some research, and of course, very busy inpatient loads usually, as well as clinic. But in the second and third year, you start to mirror a little bit of what you'll do if you stay in a mixed role. And so time management is definitely something that I think is important to start to think about in fellowship. I was lucky to be at a training program, as most of our training programs are, associated with great medical schools, and so was always interested in teaching. And we have a medical student course in as all med student schools have. We have a brief period in endocrinology. I also direct that right now. And I started my endocrine education interest there. I was a preceptor for a lot of the labs. Traditionally, they were run by some faculty, and I asked if I could help with those, and really kind of asked about where I could help support teaching as best as I can.
So you started pretty early on, trying to zone in on your interests. Is that a correct way?
Yeah, absolutely. And I have to say, I didn't plan on becoming a program director, at least at this stage of my career. I'm now in my 6th year as faculty. And so I thought that was something I would definitely work towards at some point, but I had no idea when my mentor would want to, step down, or if I would be chosen as program director. But that's where being sort of motivated can help a lot, because as I said, there was no associate program director position, but I was doing a lot of things to support my mentor just because I was interested in teaching. I had started a new endocrine new fellows boot camp for our incoming fellows. And so they said to me at that time, we don't have any protected time to give you because this is not a position that's been there before for associate program director, but you kind of earn the title by just being motivated and asking to do things. And then that was a very natural way for me so although I didn't get the protected time in the beginning, and I put in some extra work, which was not always easy, but that led to a really wonderful opportunity. And so, having that mentorship, which is something that we've talked about a lot, and also offering help just because you're passionate in something. I mean, time management also involves saying no and not doing more than you can do, but this was something that I was particularly passionate about. And so that's part of how you sort of manage your time, is really focus on the things that you want to work for the rest of your career. You're beyond the stage where you have to say yes to everything. I know it does not feel that way. It still doesn't feel that way, but certainly I've gotten a lot more comfortable at saying, thank you for the opportunity. I don't think I can do this, but here's a person I think might benefit. And that's how you sort of pay it forward as well.
Thank you so much. Dr. Zhang, what made you pursue the third research year? And you said you probably decided on it in the second year, right? So just lead us through your thought process.
Yeah, so I knew early on in residency that I loved, when you come across a clinical question, being able to at least try to answer that question. I just found that very exciting. I really wanted research to be part of my career somehow. So early on, I found a mentor who was very supportive and a project that I was interested in. So late first year, early second year, I reached out to my mentor, started discussing the possibility of doing third year and what are the steps I need to take. And I did a third year for several reasons. One is to gain more research experience, both clinical and in the lab, because I do translational research. Two, like Meltem said, it is really hard, especially the first year, but even sometimes second year, you have a lot of clinical responsibilities to find that time to generate the data that you need. So that third year buys you time to finish your project. And if possible, try to at least as soon as you can submit just a paper, so that when you apply for the career development awards, you have something under review. That's very helpful. Also, when you decide on a research career, that third year can really be an important time for you to find your own independent focus. So what you want to do is take the preliminary data and the project that you're doing with your mentor and think about, what can I develop that's related to it, but separate, that I can develop into a career in the next 10 years. That's very important. And finally, it takes time to submit grants. So that third year, you can be writing grants and starting your first submissions. So what I recommend, just like Meltem said, time management. Make a timeline of things that if you decide to do a research year, make a timeline of things you want to accomplish. These are the grants I want to apply for. These are the things I need to finish my project. I want to submit a paper around this time. Abstracts that you want to submit for. You may not reach all your goals, but having a plan is really helpful.
Can I just jump in and piggyback on a couple of things? Fellows are so often so hard on themselves about, having the perfect research. And I absolutely agree. The more you can get done to plant a seed for career development grants during fellowship, and that extra time really helps you, the better. But I have seen that research doesn't always go perfect. And for various reasons, for mentorship, even COVID really got in the way of some of the clinical work that some of my fellows were doing. So don't get discouraged if research is still what your heart is in. For me, it's really important that you learn methodology more than anything. So you're learning how clinical trials are done, or you're learning the wet lab techniques that you might need to answer the questions. And networking is also really important, because so much of research is collaborating. And you may not have the skill set for something, but you may know the question you want. And so knowing who you can go to. There are options for, even I had a fellow last year who did a fourth way. We call that a pathway to instructor position. So she did a fourth year to gain additional, lab and publication experience. Now, obviously, we don't expect you to do unlimited training. I know that, and we've got loans to repay and all sorts of things. But if your heart is really in research, and for whatever reason it doesn't go perfect, just speak up and really let your program director and your mentors know that you still want to do this, and help you refocus if needed.
Thank you so much. Many of the fellows start thinking about building their own niche, whether it's diabetes, obesity, metabolism, thyroid. So how do they start building that portfolio, if you will. Any tips? And this question is for both of you.
I think it's many fellows come in with interests. They know they love the thyroid, for example, or they love diabetes, and then some programs have areas. My program, for example, is especially strong in thyroid and genetic diabetes and type 1, but we don't have as much adrenal and pituitary, for example. And so some fellows who are kind of undifferentiated, they gain interest in what they're most exposed to. But in my own example, for example, my diabetes is still my first love, but I do 50% osteoporosis, and I was interested in diabetes in older adults and endocrine health in older adults. And so the faculty position I was offered, required that I do 50% osteoporosis, and then I could do diabetes in older adults as well. So I grew to love it just by what was around me. And that doesn't work for everyone, but I really do enjoy bone disease, and my research interest is bone fragility in patients with diabetes. And so it's really just sort of taking advantage of what is in front of you, and possibly, also just advocating for what you love. I made it very clear I would love to do this bone position, but my contract has to say I'm still doing 50% diabetes, because that's, that remains my great interest.
Yes, and I would agree with that. I would say one of the goals that you should try to set your second year is maximizing your areas of clinical interest. If you can identify that early, even if you want to do research, we're still clinicians, and that is, our bread and butter. I think if there was one thing that I wish I could have done better my second year, would be being more deliberate about seeking opportunities to enrich my experience and knowledge in my area of clinical interest. So if you're interested in thyroid biopsies, go to extra thyroid clinics. If you are interested in bone, there are endocrine fellows, Fellow Foundation has this metabolic bone conference. If you're interested in diabetes, spend some time with the diabetes educators. They're a great wealth of knowledge, but just be deliberate. I think that's very important.
That's a really good segue into something that I really want to mention also. On the one hand, we're saying expose yourself and do a lot of things, but fellowship is a really unique time where you get more time than you'll ever have likely as an attending again. It gets really hard, whether you're clinical or research, you're pretty busy in a different way. So one of the things, whether you know what your interest is or you're not sure, I cannot recommend this enough. Go to every meeting you can, even if it's not something you're super excited about, because you have, number one, a little bit more protected time, and you can always ask your program director, say, this is something I'd really like to attend. It's really hard to attend a lot of meetings once you're, in clinic or have a lot of lab meetings. The other thing is there's a lot of subsidies, like the ADA, where, they do such a nice job through this program of subsidizing your registration fee. And as an attending, meetings become even more expensive. And even if you have the time, you may not have the budget to attend everything. So really try to attend, especially in your second and third year when it's a little bit easier, as many meetings as you can. And that'll help you grow your interests too.
So thank you both. Now, there's a question from the audience, and I'll just read it out. And Dr. Zeytinoglu, you can go first, and then Dr. Zhang. Do you think it's possible to still develop your niche after fellowship?
Yes, absolutely. So again, I don't mean to refer to myself at all, and over and over. But my own experience is an example of that. I did not, because I didn't think that bone was my primary interest in endocrine. I got my usual experience that the average sort of endocrine fellow would get until the very end of my fellowship, when I actually did attend, once I knew I would become a bone specialist, the Endocrine Fellows Bone Conference, which I cannot recommend enough. It was a great experience. But then I learned on the job, and I learned, as a junior attending, I became an expert in bone along the way. So certainly you can definitely continue to learn after fellowship. And again, there's lots of didactic opportunities, and you don't have to know exactly what you want to do. It helps. It's nice if you do, but a lot of times we evolve during faculty based on what's available around us.
Dr. Zhang?
Yeah, I mean, I would say I'm early enough in my career where I'm actually going through this right now. And I feel, because that was one of the things I wish I had done, and I wish to impart on other fellows now is, taking advantage of your second year if you can. But yeah, I mean, I feel like, I'm lucky enough to be at an institution where if I want to, for example, subspecialize in diabetes, I have people who are, relatively, considered experts in the field that I can reach out, that I know. I just have to be more deliberate and about, what kind of educational resources that I need to seek out now after training to, become an expert in that area. But definitely. And, some of these, I feel like some of these areas of clinical focus may also evolve depending on the job situation. Like Meltem said, maybe your division will require somebody who specializes in a certain area, and you're like, oh, that's a great idea. And then you become an expert in that area. So we're constantly learning. Nothing is set in stone.
So that provides actually a lovely segue to expanding our training beyond just endocrine. Can we just talk a little bit about what other potential pathways are there to boost up your CV, your learning?
Dr. Zhang, I know well, actually, no, Dr. Patham, this is in your program that you do. Can you tell us a little bit about your lipid experience that you do in your own program?
Yeah, so I, 2 years into my fellowship, I felt like I needed to learn more about lipids, and I certified in American Board of Clinical Lipidology. And I brought that concept to the department. And I think since last 2 years, all our fellows are, trying to get the NLA certification, the ABCL, American Board of Clinical Lipidology, and you become what we call as lipid specialists. And of course, this year, we also had fellows who gave the obesity boards. All my third-year fellows have given obesity boards. So that boosts up really the CV. And I think last year also one of my fellows gave the obesity board. So, you're expanding your expertise. That's one of my recommendations. Other options are there too, right? You can get certified in densitometry. Dr. Zeytinoglu, you mentioned hypertension boards as well, correct?
Yeah, absolutely. So, depending on what you want your niche to be, for example, if it's women's health, you can be certified by the North American Menopause Society in postmenopausal management. I'm a certified clinical densitometrist, or CCD, because I took the bone density certification exam, and you can do that. There are hypertension boards at the University of Chicago. We actually have 2 advanced fellowships. So historically, some of our third years have elected to stay on for a third year to become better trained in hypertension, endocrine causes, and general hypertension, cardiometabolic. that's a luxury that not every program has. And many years it's filled by cardiology and nephrology trainees as well. But certainly it's also a really nice way if you cannot be funded for a third year through a T32 grant. That many of our fellows use, looking for other advanced training, whether that be preventive cardiology, if you want to do, cardiometabolic risk, hypertension. We have an advanced diabetes fellowship that's relatively new, so we'll have a third year who's going to do that next year. So there are all sorts of certification exams. I love the idea of the lipids because not everyone gets it. Some of the lipids are managed by cardiology, and not all of our endocrine fellows across the country get enough lipid exposure. So this is a really good way to give yourself that extra expertise. So, even if it's not going to be your subspecialty, if you have the time or interest to learn more, it's a good opportunity, and it's a good way to sell yourself for a job that you have this additional training and give yourself that selling point as well.
Yeah, and I'm sorry. Just to piggyback on something that Meltem was saying, finding funding mechanisms for the third year, if you are interested in research. Like she said, many institutions do have the T32, which is for postdoctoral research. But if you don't have that in your institution, speak to your mentors, because there are other funding mechanisms. There are a lot of institutional funding mechanisms. For example, at WashU, we have something called the Dean Scholars, or there's many institutions have a KL2. And these are smaller awards, typically 2 years, but they buy you time. And I'm sorry, I don't want to scare anyone into thinking you have to have a publication to apply for a career development award. I don't have one right now, and I will have a career development award, at least institutionally right now. So, those are the best case scenarios, but don't worry, things do not go as planned, and you can still make things work. The most important thing is having, knowing what you want, being open and communicative with your mentor and your division. And a lot of times they're very supportive towards your interests. So
we have 2 minutes left. So I'd like for Dr. Zhang to say just final words of advice, and then Dr. Zeytinoglu.
Yeah, like Meltem was saying, the second year, it goes by very quickly. I think the most important thing is think about the priorities that you want to accomplish. It's very busy. Think about the clinical, the personal accomplishments that you want to accomplish. Also, of course, boards. We didn't get a lot into board preparation during this session, but any of us will be happy to give any kind of advice. But, just make a list and prioritize and, make the most of that time.
I agree. Fellowship is one of those special times, kind of like college, where you look back and you're like, wow, I had so many unique opportunities. And in some ways, I wish I could do it over again and do even more. Obviously, you're excited after so much training. You just want to finish. But I would and totally understand that. You want to start making a salary. Just pause and take advantage of as much as you can. But know that we're not perfect. And even after fellowship, you'll have a lot of great opportunities if you remain motivated and continue to seek mentorship and experiences.
So I'm truly thankful to both of you for being here, for sharing your experiences, opening your heart. This was very valuable, and you always go back and say, I wish I had done that. I wish I had known about this. I hope this session has provided that. So thank you so much.